Welcome to the recorded version of Understanding COPD in Older Adults, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Our speaker today is Molly Carpenter. Author, speaker, trainer, and family caregiver, Molly Carpenter brings years of personal and professional senior care experience and training to families dealing with dementia care. In her current role, Molly works with a team responsible for ensuring that the Home Instead Senior Care Network's 60,000 caregivers worldwide have the resources necessary to effectively provide quality care in the home and understand the importance of their work enhancing the lives of those they serve. Molly holds a Bachelor of Science degree in Family Science with a gerontology specialization from the University of Nebraska-Lincoln and a master's degree in education with a gerontology specialization from the University of Nebraska at Omaha. And with that, I would like to welcome Molly Carpenter to the presentation. Thanks for being here, Molly.
Thank you, Steve, and thanks again for that warm welcome. Good morning, good afternoon to everybody out there. I hope you're all doing well today. You know, it came to my attention this morning that we're springing forward on this weekend, I believe. And so I hope your weather's getting a little more spring-like. Ours is here, so I hope all is well with you all. I'm ready for spring, that's for sure. This winter's been a long one, but anyway, I just want to thank you all again for joining the webinar today on COPD. And I'm going to start this webinar with a few stats to really put this disease in perspective for us on the next slide. Now, COPD is one of the most common of lung diseases, and it's a condition that can impact a senior's ability to breathe well. Within the United States, more than 24 million people, or 6.3% of the U.S. population, currently suffers with this disease, and that's according to the Centers for Disease Control and Prevention. Also, according to the National Heart, Lung, and Blood Institute, it's the third leading cause of death in the United States. Now, we've also looked up some information for our Canadian listeners today, and the Canadian Lung Association says there are 3 million Canadians that have COPD. And as you can all probably guess or imagine, that smoking is the leading cause of this disease, which, again, I'm sure is no surprise to any of you. It was no surprise to me. But long-term exposure to other lung irritants like air pollution or chemical fumes or dust, some of those things can also contribute to COPD. Now, when we think about this disease, this can be a scary one for families. Whenever breathing is affected, anxiety levels are high for the senior that may have COPD and for the family that is the caregiver. So let's look at our objectives on the next slide and talk through really how can we better support our families that are caregivers coping with COPD. So we're going to go over 3 big things today. We're going to first look at the common symptoms of chronic obstructive pulmonary disease, or what I keep referring to as COPD. We are going to list possible complications, and then we're going to look at treatment options. And when we look at those treatment options, we're going to look at it from an aspect of actual medical treatment options, and there's also some non-medical treatment options that we can look at and really understand and talk with families about. And as we go through this today, I want you to think about the conversations that you've had with families already on this topic. And as we're going through this, really think about if there's any new information you can gain to share with families. Is there a better way to explain things to families on this disease? Is there some gaps in the knowledge or some new tips you might learn? So be thinking about all those things as we go through this webinar today. So I want to start with describing actually what is COPD, and I want to look at that on the next slide. And like I said, it does stand for the chronic obstructive pulmonary disease, and it's a group of lung diseases. And for me, I find it really helpful to understand what is actually happening in the lungs, so that as we're talking to families, we can explain it a little bit, and we can also explain it in more of a simplistic manner. I know a lot of our doctors out there, they use sometimes those big words, and and I start to glaze over and say, because I'm trying to figure out what that word meant in the sentence he said 2 or 3 times ago. So I sort of looked at this as, what's a simple way to talk through this with a family? And according to the Mayo Clinic, COPD affects the lungs as follows. So we start with the air travels down the windpipe or the trachea. It goes into our lungs through 2 large tubes, which we call bronchi. And inside the lungs, these tubes are divided many times like branches of a tree. And at the end of those branches are those tiny air sacs. Now, the air sacs have very thin walls full of tiny blood vessels or capillaries. Again, blood vessels is an easier term to use. And the oxygen in the air you inhale, it passes through those blood vessels and enters your bloodstream. At the same time, carbon dioxide is exhaled. So the lungs rely on a sort of a natural elasticity of those bronchial tubes and those air sacs to force air out of the body. So COPD can cause those bronchial tubes to lose that elasticity, and they can even partially collapse. COPD can also cause the walls between the air sacs to be destroyed. So the effects of the walls of the airways this affects those walls of those airways, and it causes them to become thick and inflamed. And when they become thick and inflamed, the airways make more mucus than usual, which then, of course, clogs the airway. And that pretty much is what makes the lungs not work right. So when you think about spelling that out for families, I know that that's kind of even a long-winded way to sort of say all of that. But I think it's important to really, in a simplistic manner, help families understand exactly what's happening there. Generally, the lung damage that's caused by COPD cannot be reversed, which is kind of the bad news of this deal, but there are treatments that may help control the symptoms and potentially minimize future damage. The other thing is that the common symptoms of this disease of COPD, they don't usually appear until after there's already been significant lung damage. So this might be one of those reasons why people still smoke and they don't think it's causing any damage. They hear about the risk, but it doesn't sink in until they feel those symptoms, which again is unfortunate because once they start to feel those symptoms, the damage is done. And the other bad news about this disease is that symptoms usually worsen over time. And I think the families probably understand that. A lot of times with these chronic conditions, they are chronic, they are ongoing, and they're eventually going to get worse over time. I don't think that's necessarily going to be a shocking factor for most of our families that we're talking to on a regular basis. So let's look at some of the symptoms that our family caregivers need to look out for on the next slide. So there's some common symptoms that COPD may include. Shortness of breath is probably the most common one. It's the one a lot of people associate with the disease and they talk about. And this is the one I think is pretty scary for a family caregiver. This can lead to panic in the person. So the person that actually has COPD, they can get very upset and nervous about a shortness of breath. And when that happens, that attack will continue. So the flare-up or whatever is occurring, when you're in a panic state, it's not going to go away any quicker. So the point is to help our families stay calm and remain calm when these symptoms occur. But when you think about shortness of breath, just that one alone, since it is the most common, there's some things that we can automatically help families understand and some suggestions and tips when this does occur with a loved one. So the first would be, obviously, let's make sure the person is sitting up or help them sit up if there's a shortness of breath. I've also seen the tip of having them lean forward slightly and using their hands, maybe putting their hands or their elbows on their knees so they're feeling a little bit more stable. The other thing family caregivers can do, and I've seen this actually work in person, is gently rubbing the person's back, really trying to get them to concentrate on a very soothing motion so that they're not focused on the not being able to breathe very well. So it's idea of getting them to remain calm and focus on something different and slowly get rid of that shortness of breath or get their breathing back to normal. We also have to have family caregivers encourage their loved one to breathe in through the nose and blow out through the mouth. Sometimes even just talking through that with the care recipient really helps them concentrate on that actual action rather than, oh my gosh, I can't breathe. And then calmness, remaining calm in the situation. I think that's the biggest factor that we can help families and really try to keep reiterating with our families. When we're tense and upset, the care recipient or their loved one, they're going to feel it, and that's the bottom line. So if we could just help families to, again, this is where these family caregivers, boy, we ask a lot of them, but this is one where we really need them to remain calm in the situation as much as possible. So some other symptoms that are there on the slide that families need to watch out for include that persistent cough, a chronic cough that also may produce that some sort of a mucus. It could be clear, it could be white, it could be yellow, it could be greenish. Boy, I hope none of you are eating lunch right now, but I apologize for the detail. Wheezing is another symptom of COPD. Chest tightness, lack of energy. When you're not breathing very well, your energy level is not where it usually is or where it should be. And then blue lips or blue fingernails or blue tips of your fingers is another symptom of COPD. Now, I know I talk about this on our webinars a lot, but this is another one of those examples where it's really important for families to understand the symptoms, and I would encourage you all to have families even to start journal and tracking some of these symptoms on a regular basis. I hate to use that word journal because I don't want people to think, we want them to write a whole book about the symptoms of the day. It's even just a notebook where you write a few sentences of how were the symptoms today, where were we at, what happened, were they bad, were they worse, those kind of just a little bit of clues. And it helps to understand when flare-ups occur. It helps to understand triggers. And it also is, again, that important notes that you can take in to the doctor's appointment. So these families can walk in with the notes that they've taken and really show the doctor the pattern of the symptoms, which is very, very helpful. It helps with understanding the progression and recognize changes. So let's go to the next slide and talk about how COPD is actually diagnosed. Now, there's there's a few lung function tests that measure how much air a person can breathe in and out, how fast they can breathe air out, and how well the lungs deliver oxygen to the blood. The most common lung function test is the spirometry, and this is a painless test. And what happens is a technician will ask a person to take a deep breath in, and then they blow out as hard as they can into a tube that is connected to a small machine. And that machine is the spirometer. That machine measures how much air the person breathes out. It also measures how fast the person can blow air out. And this test can detect the COPD symptoms before they develop. And I've seen this, I've actually used this test as a wellness professional at one point in my career. We used this test on a regular basis with participants, even just to give them a baseline of where they were at. And of course, in this type of a setting, we were doing lots of exercise with these participants. And so we would do the test again to see if their, lung and heart function got better after improving if they've been doing a lot of cardiovascular exercise. But my point is that this test is a pretty easy one. It's not scary, and it's out there at these different wellness fairs and different events. So encouraging families to partake in wellness fairs and look for these opportunities, even to get a baseline, even if the person smoked, in their early adult life or early life and then don't smoke anymore now, it still would be important to get that test done. There's also chest x-rays, the CT scan. Those can show signs of issues. And there's an arterial blood gas test that measures oxygen in the blood, and it can really indicate the person's need for oxygen. So a lot of these tests are pretty painless, and if there is any concern or the person is a smoker or is having any trouble breathing, these tests are good to encourage the family to think about, to ask about at doctor's appointments for the future. Now, there are some common conditions that make up COPD. We talked about how this was a grouping of diseases. So let's look at those on the next slide. COPD refers to two conditions, emphysema and chronic bronchitis. Now, emphysema is a disease that destroys the walls and that elasticity or the elastic fibers of the air cells in the lungs. Now, in addition, airflow from the lungs is impaired due to small airways that are collapsing while exhaling. It develops very gradually, as we said, so people don't even know that they have it, or they ignore that little cough or those little changes in breathing. I've noticed that depending on the day, walking up 2 flights of stairs, I can be winded. Some days I'm not winded, other days I am. Now, I've never smoked, so I'm not worried about COPD, but those are those little subtle changes that an example of a subtle change where somebody may not be paying attention quite to that type of a symptom. Now, chronic bronchitis is a condition that causes inflammation in the bronchial tubes. At the same time, the lungs may produce more mucus, which further blocks the inflamed tubes. And this is where that chronic cough can develop while trying to clear the airways. So what about asthma? Where does this fit into lung conditions? Well, as I said, COPD is an umbrella term used to diagnose people with emphysema or chronic bronchitis. And the changes in the body that cause shortness of breath are similar between COPD and asthma. The airways, again, become swollen and filled with mucus. But with asthma, this occurs usually because of a factor in the environment. And some of those environmental factors could be pet dander, it could be dust, it could be smoke, it could be a variety of things. The other difference between asthma and COPD is the age in when symptoms typically begin. Asthma is diagnosed typically in childhood, and COPD is diagnosed in 40 years or older. This, again, is because of the years of smoking, which causes that slow progression of the disease. So although it's uncommon, some people who have asthma can develop COPD because asthma is, again, a chronic condition, and treatment usually can reverse the inflammation and the narrowing. However, if there's not the right treatment or enough treatment, or it's not caught early enough, that's when that COPD can develop. So I want to look a little bit closer at emphysema and chronic bronchitis. So let's start with emphysema on the next slide. So as I mentioned on the slide before, emphysema is a disease that destroys the walls and the elastic fibers of the air sacs. And we also talked about how the airflow from the lungs is impaired because those small airways are collapsing and exhaling. But I want to review a little bit deeper what, again, is actually happening in a simplistic way so that we can help families understand this disease and understand what's actually happening to their loved one. So the lungs' air sacs are clustered like bunches of grapes. And in emphysema, the inner walls of the air sacs weaken and they eventually rupture, creating one large air sac instead of many small ones. So what that does, it reduces the surface area of the lungs and in turn, the amount of oxygen that reaches the bloodstream. So when a person exhales, the damaged air sacs don't work properly, and old air becomes trapped, leaving no room for fresh, oxygen-rich air to enter. Now again, as we said before, treatment may slow the progression, but it cannot reverse the damage. So that's, again, the bad news of this disease. Let's take a look at chronic bronchitis a little more in depth on the next slide. Chronic bronchitis is a condition that causes the inflammation of the bronchial tubes, and again, those lungs may produce more mucus, which can further block those inflamed tubes. And when the airways are inflamed or infected, less air is able to flow to and from the lungs, which results in that chronic cough. People often ignore the signs of chronic bronchitis because they think it's non-life-threatening. They don't think it's a big deal. They think there's something in the environment that's, maybe it's an allergy that they're just having a little reaction to. Maybe somebody, if they live in a care community or they've been to a big event recently, maybe somebody else had a cold and they think they're just got a little bit of that cold and not the full-blown cold, and so they just have a little bit of a cough. So the scary thing is that when people wait to seek treatment, lungs can be seriously injured and damaged already. So it's when we're talking to families and they say mom has a little cough or dad has a little cough, the next question, are they smokers or have they been smokers? And if the answer is yes, that's a symptom we can't ignore. I know with my own grandmother, God rest her soul, and I don't know if she would love me telling the whole world this, but she was a lifelong smoker, and she had lots of bouts of these little coughs. But we knew that she was a smoker, so as she would get chronic bronchitis or get the bronchitis, we would call the doctor and get the medication we needed and really help her through that. But she never associated that smoking with chronic bronchitis or the cough, the little cough. She never put two and two together. Even though we told her that that's what it was from, she still was like, oh, no, that's not what it's from. I just have a cough right now. It's winter, and I have a cough, and everybody has a cold. So it's interesting, as I was putting this content together, that is very true. And I'm sure a lot of you have experienced that in your jobs as well, this sort of denial about the chronic cough. So the other thing about ignoring those little symptoms, it can really increase the risk of serious respiratory problems or even heart failure. And so that's why it's important for families to understand the symptoms, document them, and stay on top of them with their senior loved one's doctor. Now, as I just said, the good news is that chronic bronchitis, if it's found early, there's a lot that can be done to treat and help manage the disease. So that's the good news. Now, before we go to treatment, though, I want to review the possible or potential complications to COPD. It's really important for families to understand those as well. So let's look at those on the next slide, these potential complications. And we start with respiratory infections. Now, people with COPD can be more susceptible to sickness, such as colds, the flu, and pneumonia. So because of this, there may be increased difficulty in breathing and even more damage to the lung tissue. From a respiratory infection, an individual with COPD might contract. So we've got to be careful when a senior loved one has a cold and, again, has COPD, it's a little bit more serious than somebody without COPD. Now, a way to prevent these flare-ups or these respiratory infections is the annual flu vaccination. This is another one of those points we can make when we're convincing people to go get the flu shot or the flu vaccination. And then the pneumonia vaccination. So we really need to, this is another way to educate families on the importance of these vaccinations every year. High blood pressure, another complication of COPD. It may cause, what COPD may cause is that pulmonary hypertension or high blood pressure in the arteries that bring blood to the lungs. Now, a doctor would need to monitor the levels and use oxygen therapy to lower this form of hypertension. So, again, there's a treatment option, but it's one of those potential complications that families need to understand when they receive this diagnosis for the first time, or maybe just have their senior loved one has a flare-up. It's always good to remind the family at that time of some additional complications that may come up in the future. Heart problems, another complication. COPD may increase the risk of heart disease, including heart attacks. Now think about this. If you aren't getting enough oxygen, your heart is working harder. It's that simple. And I think that's a very simple way to put it to families. The other side of that is when a person has difficulty breathing, they may not exercise on a regular basis, and they may not get around as much, or they may not feel like moving around too much because their breathing is compromised. I had a gentleman one time who I worked with in a retirement facility. He had COPD. He was overweight, and he had the heart problems that were associated with COPD. And it made me absolutely crazy because he rode around in a motorized scooter all day. And here's why it made me crazy. He lived on the first floor of the facility. He was steps away from the dining room, for example, but he would always ride the scooter to the dining room or to the mailboxes, which, again, were right there on the first floor, right by his room. So for years, his doctor told him that he needed to get more exercise and that it would be good for his heart and his lungs to do some light exercise. So after a while, when you work in a facility, a lot of you that do, the motorized scooters, there's complications with that whole thing, which is not for this topic today. But we sort of used, you really need to get some more exercise because we don't want all those motorized scooters around. And when there's a lot of residents around, motorized scooters, you don't want any accidents, right? So we started really to encourage Jim to get up and do some light exercises. And the only thing we asked him to do was start to walk to meals. But we even just started with one meal a day. And then after a month or two, we moved it up to 2 meals a day he needed to walk to. And we eventually got to all 3 meals. And then we got to he could walk to all 3 meals and go to the mailbox. And so there is hope. And I guess the message is that when we're talking to families and we're worried about the complications of COPD, there is still encouragement that we can give. There is still ways to encourage them, to encourage their loved one to combat some of these complications, if you will. So the point is to start slow. And just to, like I said, with Jim, we started 1 meal, and that's all he had to do for a whole month. And I can't remember if it was every month we moved him up or how we did it. But he actually, this was hard for him to admit, but he actually, after maybe a year of doing these little bits of exercise, said he actually started to feel better. So that was a huge win. I'm not sure he lost a bunch of weight from just this little exercise, but the point was he was moving around and he was feeling better. That was the key. Now, lung cancer, that's another complication of COPD. Generally, individuals who smoke and have chronic bronchitis, they definitely have a greater risk of developing lung cancer than smokers without it. So that's always, I'm sure that's not a big shock to families, and I think that's probably in the back of a lot of people's head about, oh boy, is my person, my loved one, my mom or dad going to get lung cancer eventually? Is that going to happen? So I don't think that's a big shocker one to share. And then depression. I've seen this one firsthand. I'm sure a lot of you have seen that. Many people develop depression because they're not partaking in everything they used to do. They're not doing activities that they used to do. And that may be because they're having, difficulty breathing. We talked earlier about that sort of panic of, oh, what if I'm out and something happens? And what if I have an attack and I can't catch my breath and I'm not, in a safe place, or I'm not in a place where I can get help right away. The other thing is I've seen my biggest reason I've seen people kind of stop doing as much activity is the oxygen tank that they may have to carry around with them. That's a barrier. So I love it, though, because in the last few years, they've really gotten creative with ways to make oxygen tanks smaller, attach them to walkers, even put them in little purses. I mean, I think they've gotten very clever about hiding the tanks or making them easy for people to cope with. And so I think that hopefully that's been helping people not feel like they want to not go out because they have an oxygen tank. So families need to be aware of that right off the bat, and to watch for those signs, and to keep finding ways to encourage them to stay active, keep doing the things they love to do. They may just have to do it a little slower or not as often, or whatever the case may be, but it's really important to avoid that depression, is to really keep them active and social. And then the last complication is exacerbations. Now, a person may experience times when those symptoms are worse for days or weeks, which is known as those exacerbations. They usually start from a lung infection caused by a virus or a bacteria, such as a cold or some other illness. Also, exposure to pollutants can cause a sudden worsening of symptoms. And if these are not treated, it could lead to lung failure. So this is pretty serious stuff. So when we are talking to families, it's important to understand and know what to do and respond during one of these flare-ups or an exacerbation. The lungs may suddenly produce more mucus, or the airways get narrower. Something's occurring. And when one or those two things happen, it reduces the airflow to the lungs, making it harder to breathe and the cough worse. This is where medication or those inhalers can help relax the bronchial tubes, which is going to help that person breathe better. Unfortunately, if those fast-acting inhalers don't work, that's where a person may have to consider a trip to the emergency room or calling the doctor right away to see what the next steps are. So these exacerbations we've heard about them. I'm sure we've all seen them happen. We've seen all the commercials for the inhalers that can help with these things. So helping families recognize when a flare-up's happening that's a little bit more serious, and helping them understand the use of the medications is the key here. Okay, let's look at some treatment options for families to consider on the next slide. As we're just talking about inhalers, let's look at some more treatments on the next slide. So the goals of the treatment really are to relieve symptoms and to slow the progression. The other goal, which I think gets missed sometimes, is to keep the person active and maintaining their current lifestyle to avoid that depression, okay? So yes, treatment and the medications are to relieve symptoms and slow progression, but a huge benefit that we can sell to families is also about keeping the person active and maintaining their lifestyle. So COPD can be treated with medication, and the goal of that medication is to relax the muscles around the airways. This helps open them up, and those airways up, and then makes it easier to breathe. Inhalers are also an option that we've just talked about on the last slide. One of the most important steps of a COPD treatment plan, though, is to stop smoking. It's really the only way to keep COPD from worsening. I know that sounds way easier said than done. And I understand when we're talking to families, especially with aging loved ones, it's hard to get them to stop smoking if they've smoked their whole life. My grandmother passed away. She was 98, and her last cigarette was when she was probably 97. So, I mean, it was just one of those deals where it was really, really hard for us to, get her to stop smoking. And we sort of reached a point where, she's lived this long. She knows the risks. She knows that the COPD, caused her heart issues and was causing problems. But, at that point there was really not a lot to do. But I think about those seniors that are young seniors, the seniors who are in their 70s and 80s. That is really where families should really encourage to stop smoking. again, easier said than done. I think there's a lot of great programs out there, and I know a lot of you have those resources handy for families to share with families. A doctor may also, though, prescribe lung therapies like oxygen therapy. And this is that where the person may be carrying the tank around or have a big tank at home, and it's through a mask or that nasal prong that they would get some oxygen. And doctors also usually prescribe a pulmonary rehabilitation program. These are great programs because it really not only talks about, the different therapies and medications, but it also talks about how to manage the disease day to day. It also gives those non-medical type solutions to some of those symptoms like exercise and nutrition. There's even sometimes in those rehab programs counseling. There's support groups. There's activities. There's a lot of great things to those rehab programs. So definitely encouraging families to think about looking into those types of programs. And then surgery is an option for some people with some forms of severe emphysema who are not finding relief with medications alone. It's usually a last resort, and the type of surgery, one of the types of surgery is called the bulectomy, and this is when the walls of the air sacs are literally destroyed, and those larger air spaces form. The air sacs can become so large that they interfere with breathing. And so during the bulectomy, the doctors remove one or more of those large bullae, that's what they're called, those big sacs, from the lungs. There's also surgeries that involve lung volume reduction, which actually removes parts of the damaged lungs. And there's also lung transplants. We've heard about those. Now, we don't hear about them very often, but there are lung transplants for those very severe cases. Now, I want to look at some more of those non-medical forms of treatment on the next slide, because when we talk to our family caregivers, this is where a lot of these non-medical type treatments are really where the family comes in, and it's really where the family can influence the type of care and the progression of this disease. So the first one is avoiding those contaminants. Maybe it's dust, secondhand smoke, pest sprays. So it could be help with housekeeping, could be reducing dust. Maybe it's an air filtration system or one of those air purifiers. Maybe it's getting the ducts in the house cleaned, the air ducts cleaned in the house, so to speak, on maybe once or twice a year, or however much those companies recommend. But really thinking about ways to avoid some of those contaminants that can get in the lungs and cause those flare-ups. If there's a need for pest control, maybe making sure the loved one is not in the house, and give it some time for it to settle before go to lunch while they're spraying and then come back, so to speak. Some ideas like that. If the person stops smoking, there's quite a lot of cleaning to do around getting all of those toxins out of furniture. Out of maybe if they smoked in their car, maybe the car needs to go in and get vacuumed out, some things like that. So when we talk about contaminants, that's a huge one, and it's a lot of different ideas to present to families, and there's a lot of options under contaminants. So the more we know about that, the better, and we can kind of help our families figure that out. Large crowds. Now this is an interesting one, a non-medical sort of tip, and it's more about being mindful when they're taking their loved one out, their mom or dad out, when symptoms are bad. Maybe it's even avoiding going out when the weather's really cold, if possible, or put one of those like a mask on their face before leaving the house. That cold air really has a bad effect on COPD. And think about if you're having to travel with your loved one, that's where that mask could come in beneficial, especially if you're traveling in an airplane. So really watching out if symptoms are bad, what size of crowds they're taking their loved one out to, kind of watching for some of those environmental factors when it comes to large crowds and when symptoms are bad. I know you're not all surprised to see nutrition and exercise on this list, but because you know me and you know how when I do these webinars, there's always a benefit to help these chronic conditions. There's always a nutrition aspect. There's always an exercise aspect. So nutrition is really about eating healthy foods and maintaining a proper weight so that it can help with the breathing. Some people with COPD actually have trouble maintaining a normal weight. A person may be actually underweight because of the difficulty breathing will cause the person to burn more calories than an average person does. Or they may be overweight because of a nutritional imbalance or the lack of exercise. So a special diet isn't necessarily needed for people with COPD, but eating those good vegetables, lots of healthy foods is recommended. Limiting salt is a good tip for families. The other one I've heard a lot of families try, or I've heard from dietitians about eating smaller meals or more frequently, like smaller meals more frequently rather than 3 big meals a day. That seems to help with maintaining a normal weight, but also with some of the factors of COPD. So again, always going to have a nutrition aspect to this. So when we're talking to families and we're encouraging them, there's just so many benefits that can come from eating well. Okay, and then there's the exercise. Regular exercise can actually strengthen respiratory muscles. It can improve the breathing, and it can improve the strength and endurance. So when I found this little stat about it can strengthen respiratory muscles, I was thrilled because obviously we know exercise has lots of benefits. But when we explain to families short walks or continuing to doing some of those, even like a gardening activity or shopping or outings, any type of movement and getting that heart going and getting a little bit of exercise really can benefit and strengthen those respiratory muscles. Managing stress is a huge one for this disease, I feel. Shortness of breath, it's stressful. It's very, very nerve-wracking. And so we've got to help families come up with a few activities that are stress relievers for their loved one. It could even be a daily nap, actually. It could be reading. It could be soothing music that's important to the person. Whatever that person does to relax, family caregivers need to have 3 or 4 of these great ideas off the top of their head that's really going to help them relax and manage the stress of this disease. Support groups. We talked about that when in some of those pulmonary rehabilitation programs. The support groups are sometimes attached to those, or lots of hospitals, lots of support groups around town that can be helpful for families and actually the person with COPD. They might find comfort in talking with others in the same situations, and families might find comfort in talking to other family caregivers about the situation. Maybe they learn tips from each other, so to speak. And it really, when we think about families, they really need to encourage their loved one, their mom or dad or their neighbor, whoever, to talk about how they're feeling and any of those concerns that they have. So it's really a good way to help people with COPD sort of release some of that feelings and really understand the disease. Some other general tips are doing things slowly. So again, when we talk to family caregivers, a lot of times we don't want to move as slow as our senior loved one. I'm very guilty of that as a family caregiver myself. But, with this disease, we're going to have to slow down a little bit. We're going to have to slow activities down and encourage the person with COPD to slow down activities just a little bit. Practicing relaxation together is a good idea. Even if it's just deep breathing exercises or taking, a few deep breaths or listening to music together, whatever it is, even asking the respiratory therapist for some breathing exercises, I think would be very helpful. So just some other ideas to help families, help their loved one manage this disease. Now, when we think about families, again, I think we say this every month, but it's very stressful to be this family caregiver. And so I do want to look on the next slide, just a few suggestions that we can help the family caregiver sort of balance their workload, balance the stress that they're having. And you'll see a lot of these tips are the same thing that we're going to recommend for the person actually with COPD. So taking time to exercise, again, it's not only essential to maintain that physical stamina, but it also provides a break in the day, okay? And I'm going to leave it at that for exercise with this one because you guys know how I feel about exercise. We talk about it every time. Asking for help, such a hard thing for family caregivers to do. But as our jobs are to encourage those family caregivers to ask other families for help, neighbors, friends, maybe hiring a caregiver, we've got to be the voice to help these families ask for help, that it's okay to ask for help. And then checking employer benefits. There are employers that offer plans or resources for families that are caring for senior loved ones. So it's showing up on a lot of benefit packages now in different companies, and it's definitely something to have family caregivers to ask about if they are still working. And then, monitoring their spirits. It's not unusual for a family caregiver to become depressed or stressed or exhausted, or when they're seeing someone they love in pain or not being able to breathe or not living the life that they want to lead. So it's important for our family caregivers they need to be mindful of their spirits, and they need to stay social, because isolation is not going to solve anything. Going on those regular outings with friends, even if they're brief, finding those little joys in everyday life that will help them, remain in good spirits or stay positive are very, very helpful. Okay, let's look at resources on the next slide. Each month I like to give you guys a list of additional resources, some more tools for your toolbox, if you will. And caregiverstress.com, that one's on this list a lot because there's just some great articles. There's Ask the Expert questions. There's lots of information about this topic and other topics on there for family caregivers. I also find the National Heart and Lung and Blood Institute has lots of resources, lots and lots and lots of resources. And COPD month is in November, which is quite a ways away. And there's a lot of tools that month, though. So if you look at that website, there's a lot of tools around the month of November because that's when the Institute does a big splash about this disease. There's even clinical trials are on this site. So if you are looking, working with families that are going through this or have a loved one with this disease, you may check this site for some clinical trials that might be available to them. The Centers for Disease Control and Prevention, the CDC, always has interesting data and resources. They also have data and resources by state, which I find very interesting on that site. And then I think the Mayo Clinic is another great site. They have a great section all about COPD. So those are just some additional resources. I invite you to share those with family caregivers as you're working with them. And hopefully they can find some additional help on this disease. All right, let's summarize on the last slide just what we've covered today real briefly, so we have plenty of time for questions. I hope you found this helpful today and encouraging, and maybe you found some new ways to talk about this disease, to talk about ways to explaining things, and just some new tips on how to help families work with those symptoms that their loved one may be experiencing or minimize those symptoms that their loved one may be experiencing. We've covered a lot today, and before we open the phone lines, just a couple of the main points. We talked about the symptoms so that families, it's really important for families to recognize those symptoms. We've also talked about the conditions that make up COPD, which is emphysema and chronic bronchitis, remember. We've talked about the diagnoses, those breathing tests, and some different options there. And then, we talked about treatment options. And yes, there's some great medical options, those inhalers, the oxygen therapy, medications. But we also talked about those non-medical types of treatment options as well. So those are the diets and the nutrition type areas and the exercise and some of those options. So again, I hope you took those down as well so that you've got some more tools in your toolbox to give to the family caregivers. Again, the goal of these webinars every month is really to find ways to continue to educate our family caregivers. So like I said, I hope you gained some insight. This is a scary one for families, so I hope we've helped you come up with ways to sort of break down or organize this conversation or really help families understand this disease a little bit more. Thank you again, all of you, for your dedication to helping families. It's inspiring every month to come on these webinars and see the amount of people that want to learn about different resources and how to help our family caregivers. So with that, I'd like to turn it back over to Steve and open the phone lines up for any questions.
All right. Thanks very much, Molly. Great presentation.
Thank you.
As you can see from the slide up on your screen, it is time for the Q&A portion of the webinar. At this point, we also want to welcome Erin Albers from Home Instead, who is going to be joining us for the Q&A here. So welcome, Erin.
Thank you.
Okay, let's get right to it here, Molly. First question. Do you see people who are around secondhand smoke as a kid or work site for years, et cetera, have COPD? So is that a potential cause of COPD?
That's a great question. I don't have a statistic on that or anything around that, but I would be interested, and I may go right to that Heart and Lung Institute site and look for that stat. That is a great question. I guess what I'm saying is I don't actually know the answer to that question. We can look that up and get it to you, but I do think secondhand smoke is one of those additional, when we talked about during the webinar of things that can cause a flare-up or watching contaminants, secondhand smoke is definitely one of those areas. So if you are taking your senior loved one somewhere and somebody's smoking, that's something to be very mindful of. So that's something we'd want to share with family caregivers. But I'm very curious about the secondhand smoke question. I'll look that up, and as we send the slides out to you all, I'll include a little bit of information on that because I'm curious. As a person who's been around secondhand smoke, I'm curious about that now myself. So thank you for that question, and we'll get a little bit more information back to you.
Okay, can you talk a little bit more about some of the deep breathing or relaxation exercises that are effective in preventing COPD or reducing the extent of lung damage in smokers?
I read an article, not too long ago, about deep breathing, and it was an article about stress and the cortisol levels in your system, which is the hormone that causes the stress. And basically, this study was conducted, and it was with family caregivers, and they had the caregivers stop, I think it was 3 times a day, and took 5 deep breaths. They didn't really monitor. I don't know if they did it morning, noon, and night, or how they monitored when they took the 5 deep breaths. But just sitting down and taking 5 deep breaths really reduced that stress level in a family caregiver. And I tell you this, it wasn't a study about COPD, but I think sometimes we get a little bit, we're looking for some sort of magical solution or a new technique when really just taking deep breaths and concentrating on those deep breaths. There was a lot of, it wasn't just taking deep breaths. It was envisioning the air going in and envisioning the air going out, listening slowly to the air going in and listening to it go out. So it wasn't just sit down and take 5 deep breaths. It was really concentrating on it and like I said, listening to it and being in a quiet room and feeling it and visualizing it. So I think that if we could encourage families to even do that simple thing 3 times a day, 5 deep breaths. I mean, honestly, I want you all right now to just take a deep breath and see how it feels. Just one deep breath feels so good. So when we're talking to families about COPD, understanding how to help their loved one take those deep breaths and the importance of it, and really practice doing it. Again, it's the lungs are muscles. They can learn, or so to speak, they can get better if we are breathing deeper and taking those deep breaths. So I don't think
we actually have on caregiverstress.com. We have some mindfulness exercises to reduce stress, and we actually have 5 steps to mindfulness and stress reduction, which covers a lot of what you just talked about, but are very specific. So if you want to go check out caregiverstress.com and type in mindfulness exercises, you will come upon an article that will help with both the COPD and just people in general reducing that stress.
Great. Thanks, Erin.
Okay, next question. Do you have any thoughts or suggestions on helping the caregiver when the individual with COPD refuses to follow the doctor's recommendations, such as exercise, smoking, etc.?
Well, that's a very hard question. And I told you guys I battled it myself with my grandmother. And the thing is, and my story with Jim in the facility, I think the thing is that slow approach. And it's pretty overwhelming to say, you have to exercise more. That's the approach we took with Jim initially. And once we said, Jim, we'd like you to walk to and from the dining room for breakfast every day, that didn't seem overwhelming to him at all. He said, oh, I can do that. And that's how we built him up to keep getting exercises, to eventually after a year he's taken a whole lap around the whole community on the walking path outside. So I think it's all about how we phrase it to our loved one. And our doctors and our nurses, and they are saying, they're probably saying the same thing, you need to exercise more. But where our family caregivers can be very effective is breaking that down into simple ideas, simple steps, think of it as one exercise a day. And I think we talked about this on the webinar last month. Again, on caregiverstress.com is a great video series with some videos that show exercises, and they're simple exercises and they're really easy to use, and there's an instructional video if you want to encourage families to even start there. So I think it's all about, if it's nutrition, again, slow steps. So we're not going to completely change the diet. We're not going to start over and you can't have all your favorite things anymore. But we're going to start introducing 2 vegetables a day or 1 vegetable a day. And we're going to not have ice cream every night of the week, so to speak. So I think as family caregivers, a step to encourage them is to really break it down and bite it off in little chunks rather than, because I've been there. I know exactly what you're going through. And it's so hard when you know that just these little things are going to make a big difference and the person's refusing. So I would just really try the approach of the smaller steps, introducing little things here and there, and seeing if you can be a little bit more effective that way.
Yeah, I'm looking at an article right now, Molly, on caregiverstress.com, in which Dr. Amy has helped someone who wrote in about their father having COPD, being tired, depressed, the mom suffering from anxiety, and here's this daughter wondering what she can do to help the both of them. And so she gives some pretty good advice on here, too, to help that family caregiver. So, again, caregiverstress.com is a great resource. There is a search function. So go ahead and just search whatever you're looking for, and numerous things will come up specific to COPD.
Great.
Okay, well, Molly and Erin, we are just about out of time. We've reached the end of our hour, and it's time for us to wrap up. But I want to thank you for joining us today and for a fantastic presentation. Thank you.
Thank you. Have a good day, everybody.